People thought, perhaps, that the woke cancer would stay contained inside of the humanities. Of course, it'll be in the women's and gender studies programs and departments. Maybe it'll sneak into the English department and at worst the history department, but that's it. It won't go any further than that. Surely it won't make it to the med schools. But of course it did. So we need to stop it. It's perhaps too late, but we must do everything we can. Congressman Greg Murphy is the only practicing doctor in Congress right now. Sir, you are the Benjamin Rush of today's Congress, the American Hippocrates. How are you doing, sir?
I'm well. I hope you are too, Mike.
Yeah, it's good to talk to you. When did this first become on your radar, this woke DEI stuff in med school?
Probably about a year and a half, 2 years ago. And the sad thing is, Mike, is that, during the pandemic, we found out that medicine then became political, especially Fauci leading the course. Sadly enough, the greatest peer pressure event possibly since the Spanish Inquisition is now overtaking what I believe is our highest level of learning, and that's in medical school. And this is where it is supposed to be something that is truly objective, truly merit-based, truly demanding of excellence for our patients. And now it's being polluted, as you point out, with the cancer of DEI. We are now treating individuals in different categories. You have people that are saying, I won't take care of a person of one race or another, or that it saddens me when I meet somebody like this. It is the most divisive, horrible cancer, if you will, that could ever happen in medicine.
Are these just rumors, or are there any examples of treating people differently? Because, and I don't mean just like a person. There may be a woke person who sees a guy with a MAGA hat and doesn't like it. Okay?
Yeah.
That's one thing. But are there examples of like, we are going to, in the name of equity, we're going to treat people of a certain race this way and people of a certain race this way to have more equitable outcomes to make up for historical injustices? Is that a mindset?
That's a mindset. And, we won't see this really until full clinical medicine for, almost a decade, because they're just really getting started now in medical schools. But, there's always truly the wonderful thing of being able to take care of patients where they are. We know of a lot of poor individuals, a lot of folks who have problems with access to care. That's never been the issue. The issue now is that skin is the thinker, or gender is the thinker, and rather than your brain being the thinker. And we're no longer fully merit-based. And, we always used to demand excellence from our doctors. You go in, I go in for our physician. We want the smartest damn person possible, or the most skillful surgeon possible. And now our medical schools are now inserting in a time when there is an explosion of information. All of a sudden we have to have diversity classes, whiteness classes. The head of the AAMC, the American Association of Medical Colleges and Universities, has a history of pushing this DEI stuff. And so I think it's a very sad day for medicine. We should not be caught up in the maelstrom of this nonsense.
What does your bill do?
We basically say, Mike, that any school that has these programs, that has DEI as its mantra, which so many now are having, don't get funded by the federal government. It's very easy. We've been working very closely with an association called Do No Harm, which is founded by headed by Dr. Stanley Goldfarb. Stanley was an associate dean at the University of Pennsylvania, and he saw this going on. UPenn has a horrible history, undergraduate now and graduate, in this nonsense, and we've been working with them very closely. I spent my entire life studying hard in high school and college and everything like that to be a physician, and then to be the most excellent physician I can be. Those standards should never be compromised, because we have to placate the far left in their DEI cancerous initiatives, divisive initiatives.
So no racial discrimination, no racist teaching about intersectionality and colonization and white supremacy, no loyalty oaths. We've talked about those before.
Yeah.
Are you worried that they'll find ways to get around it? Because, a bunch of states have done this, and I think it's Texas, where they just changed the name of diversity, equity, inclusion to belonging, the Department of Belonging, the Department of Student Belonging or something, right? Is there a way to get around it?
Sure, there's ways to get around it. In fact, the AAMC president said that when the Supreme Court came down and said affirmative action is unconstitutional, he said basically we will find ways to get around it. I want everybody to have opportunity. But you know what? For God's sake, we're not dealing with art school. We're not dealing with English lit. We're not dealing with history. We're talking about people's lives here. And it's just beyond me that we, for the sake of appeasing the far left, are willing to compromise our standards, compromise what is taught in medical school, and then have promotion, acceptances of professor or anything tied to DEI, fealty oaths, or anything like that. And it's just unbelievable. This is what the Russians and the Chinese want, and they're getting it.
Yeah, it is unbelievable. It was in 2006, my college roommate, he was pre-med, he busted through the doors. I distinctly remember this, busted through the doors and said, "You're not going to believe what I learned today." And he told me about how gender is on a spectrum. And now we see how that's mainstream. And now children's hospitals have transgender clinics in them. So that was only, less than 20 years ago. And now here we are. So as you said, 10 years from now, it'll be a totally different world if we don't do what we can to stop it.
Yeah.
What's your dystopian future?
What's that? What does this look like in the future? I don't know.
Future?
I don't know where it goes. Fortunately, businesses, which really were in the forefront of pushing this several years ago, are now retracting some. Why? Because guess what? Quality matters to them. And we want a diverse workforce, but we cannot let it be subjected to non-meritorious accolades. We can't let this happen. And, the fact that we're going to sit and divide people by race, we're going to divide people that by the definition of how much melanin is your skin, whether you're an oppressor. And look, I'm not anything saying that racism does not exist. It does exist. But it exists on both sides. And the fallacy that if you're white, you can be a racist, but if you're black or Asian or Hispanic, you can only be bigoted. Well, where does that come from? That's absolute nonsense. So, I want everybody to get along. I think diversity was happening naturally. 56% of doctors are white. 26% are Asian. And the other two, 12% is split between black and Hispanic. What I say to that is, hey, take control of the communities. Let learning go back to learning in the home. Let's work on fatherlessness. Let's work on all those things that go into factors like this. Dr. Ben Carson, who's a very, very prominent black neurosurgeon, I'm very fortunate to call him friend, is absolutely against this. Burgess Owens, who's a member of Congress, is head of the subcommittee on higher education, absolutely against this nonsense. It's not a white person thing. We spoke the other day, and we had a black female, a former DEI officer, come up and speak for this bill because she said it's just become so divisive, so horribly divisive in its theme and in its propaganda. This is not what America is about.
No. All right. What's the name of the bill?
The Educate Act, EDUCA, and it stands, it was kind of one of these long things, embracing anti-discrimination, unbiased curricula, and fostering truth in education.